Hey guys, I'm Tony Tian, and if you're new to this channel, I'm a second-year medical student at University of Otago. So today what we're going to be talking about is jaundice, and basically jaundice is a condition that you have a really yellowish skin, not like as like yellow as Asian kind of yellow, but like really yellow, almost like kind of brownish kind of color, and not brownish, but like a very intense yellow, sort of like my shirt, but less yellow than this, kind of in between my skin tone and the yellow on my shirt. Anyways, you can just Google up pictures about jaundice, and basically it symbolizes a raise in your bilirubin level. Shut up, Siri. In your bilirubin level, and so when the bilirubin level in your blood is raised, when it's not being excreted by your liver properly, then you get this condition called jaundice. And basically there are three main reasons to this, and we have the hemolysis, the hepatocellular damage, and the cholestasis. So basically hemolysis is the increased hemoglobin getting broken down, and it produces bilirubin. By the way, bilirubin is sort of like a waste product of the breakdown of the hemoglobin, and our hemoglobin is constantly being broken down, and new ones are being produced just because it has a certain lifespan, just like a human being, like in animals that live for a certain amount of time, and it gets broken down, it dies. So basically it, or sometimes when you have hemolysis, it means you have a overly broken down of your hemoglobin, and then this is gonna overwhelm a normally functioning conjugating mechanism. So conjugating mechanism is there's a process that your liver sort of excrete this bilirubin, because it needs to recognize what needs to be excreted, and it sort of have this conjugation process. There's a chemical process going on, combine the bilirubin with some sort of other substances, so it can be transported and excreted into the renal system. And when you get hepatocellular damage, and because the liver is the organ that conjugates all of the bilirubin, so if you have a hepatocellular, which means your liver cell damage, you have a failure of conjugating mechanism with the hepatocytes, and this can be either acute condition or chronic condition. And they have the cholestasis, which is the obstruction in the biliary system, and it can be intra or extra hepatic. Basically what that means is that intrahepatic is within the liver, so it's a vessel that's within the liver that's been clogged, and if it's extrahepatic, that means it's a vessel that's coming out of the liver or going into the liver that's outside of the actual organ that's being blocked. Right, so bilirubin, just gonna go through its life cycle. Basically, it's a color pigment, as I mentioned. It's a product of the red blood cell breaking down, and when it's released into the blood, it is in its unconjugated form, and we also call it it's also in an insoluble form, and so it's bound to albumin. But when it's being excreted, it cannot be excreted binding to the albumin, because albumin it's just too big of a molecule for the renal system to be excreted. So basically then is taken up to the liver taken up by the liver hepatocytes and conjugated, attached to a soluble sugar and make it soluble, and the conjugated bilirubin is secreted into in bile to the small intestine, and some of the conjugated bilirubin is reabsorbed into the portal vein and then secreted as urobilinogen via the kidney, and as I mentioned, and it is also soluble, so it travels in blood as well, and remaining conjugated bilirubin stays in the GI tract and is excreted as the stercobilinogen in feces, so it appears to be a brownish color as well. So two pathways, one is being excreted by kidney, and the other one is just to go through the GI and it's excreted with the feces. Right. So basically, now we're gonna go through the causes. So the first one is hemolytic jaundice. As I mentioned, it's caused by hemolytic anemia, and it's usually a acquired AI hemolytic anemia, and it can be drug-induced, congenital, spherocytosis, or genetic, like the HBS, the sickle cell disorder. And in the clinical presentation is that the patient may present with typical anemia, exhaust, fatigue, etc. And the spherocytosis I mentioned is the production of abnormal red blood cells that are in the shape of a sphere instead of in the concave disc shape. So it's kind of like pencil cells, just a different type of cell morphology. So in the blood test, what you're gonna get is the increased unconjugated bilirubin, and this is because too much being released, and your body just cannot conjugate all of them, and you have a released LDH as well, and basically what that means is lactate dehydrogenase, and this is a so if you have done some biochemistry, you'll know that the lactate dehydrogenase is the one that turns the glucose into lactate in a anaerobic reaction, and yeah, so basically you're gonna have a lot of that broken down from the coming out from the RBC. So you're not gonna detect any urine bilirubin in the urine because you have a slightly increased or normal urobilirubin, because it's like your body is still processing all of the bilirubin normally, and yeah, and then you have the hepatocellular jaundice and just acute hepatitis, and toxins in the liver like excess paracetamol can cause this kind of condition, causes hepatocyte damage, and may cause some cellular swelling, which may cause some occlusion of the intrahepatic bile ducts. And it's usually acute onset, short course, fever, and pain the right upper quadrant, and causes jaundice. And then you have the chronic hepatocellular jaundice, and this is chronic hepatitis, alcoholic hepatitis, and so don't drink too much alcohol, and cirrhosis. So this usually comes from alcohol abuse, and comes from you have long-term but low-grade symptoms. You get abdominal pain, viral causes, and jaundice. And then you have the cholestatic jaundice. So as I mentioned, this is a bile duct blockage, and it can be intrahepatic or extra. And basically the flow is being obstructed, and the bile is highly basic and contains a little enzyme. So basically the stasis can cause liver damage, and because all of the bile is being trapped in the liver, and causes things like gallstones, acute pancreatitis, it can be alcoholic onset or not, and cancer of the head of the pancreas, and the patient is going to complain with colicky pain. Basically it's like a spasm kind of pain, jaundice. It's generally not acute for gallstones, and it gets worse after meals. All right, so basically overall the blood test, you're gonna get increased plasma unconjugated bilirubin, hemolytic anemia, normal conjugated bilirubin, increased urobilinogen, but you're not gonna really see any urine bilirubin, and the cholestasis, in this case you're gonna get increased to normal unconjugated, increased conjugated because the bile duct is blocked, and normally as you remember, most of the conjugated bilirubin is going to be excreted through feces, but now it's being trapped in the duct, so it has to go through the blood system and be excreted from the kidney. So basically that's why you have a decrease or completely lost urobilinogen, and you're going to see the urine bilirubin. And liver disease, sort of very similar, increased unconjugated, decreased or normal conjugated bilirubin, because it can decrease if you have some sort of conjugation problem. And then you have decreased or lost completely lost urobilinogen, and the urine bilirubin is not going to be present because the accumulation is in the unconjugated bilirubin that cannot be excreted outside of the body. Alright, so that's everything I want to talk about for jaundice and bilirubin today, and I hope you guys have a general understanding about the big picture of it. And if you have any more questions, as you know, just leave it in the comment section below, and don't forget to hit that like button and subscribe to the channel, and I'll see you next time. Bye!